Hi, Dr. Michael DiMattina, Medical Director and founder of Dominion Fertility in Arlington, Virginia. And today I want to talk about male factor infertility. About 40% of the time it is the male side of the equation that's responsible for the infertility. And this is okay. There are many treatments available for this. The first thing you should know is that it's not uncommon, and secondly, there are many different causes for this. And the way we evaluate it is the gold standard is the semen analysis, where the man will submit a sample of sperm. You can do the specimen collection at home. You don't need to come in necessarily to the clinic. We evaluate it, and then we determine whether or not there's a problem with the sperm. And if so, then we sit down and talk about it and what we can do about it. With today's modern technologies, it's very rare for a person who has male factor infertility not to be able to father a child, but it requires a little bit of work. The gold standard is really in vitro fertilization, where we take the sperm and we fertilize the eggs, produce embryos, and then put the embryos into the recipient female. The pregnancy rates from doing that are extremely high. In fact, I quote live birth rates, not pregnancy rates. The live birth rate at Dominion Fertility from our IVF program, when we transfer a single embryo, genetically normal embryo, exceeds 50% per embryo transfer. It's very high. So 1 or 2 embryo transfers, we're fine. He's the father, she's the mother. What's not to like? Simpler treatments are also available. They're not as effective, such as artificial insemination, but they can also be used in appropriate circumstances. Varicocelectomy, where a man is told his vein in his scrotum or groin is dilated, is not proven to be effective. According to the American Society of Reproductive Medicine, they state that data showing that varicocelectomy for male factor infertility, showing that it causes an increase in the pregnancy rates, is elusive. In other words, there's not much evidence to suggest that that's going to be helpful. So I don't recommend usually varicocelectomy unless the man is having pain in his groin, because our goal is to produce a baby. And varicocelectomy is not usually worthwhile to produce a baby. There are better techniques that can achieve the same result, a pregnancy rate, with much higher success rates quicker. And that's what it's all about. Show me the baby. So men, if you have male factor infertility, do not sweat. There are plenty of things that we can do to get you to become a father, so don't worry about that. This is Dr. Michael DiMattina, Medical Director and founder at Dominion Fertility in Arlington, Virginia.
Dominion Fertility, making miracles happen, one family at a time.